Ladies and gentlemen, big data and data analytics are two important and advanced technologies that are already implemented and integral to today's healthcare landscape. So it's important to know that we are talking not only about the future, but actually we are talking about the present. It's important for healthcare professionals, pharmaceutical professionals to understand at least the concepts of these technologies so we can stay updated, informed, and consider those in our work. Maybe you have heard me before saying that we don't need to be leaders or masters in computer science in order to understand the technologies applied in healthcare. So what we will try to do in this tutorial is to simplify the concepts of big data and data analytics and see how can they be used in healthcare. What are their applications in healthcare and how they aim to improve patient outcomes and also enhance the operational efficiency. So let's get started. So we will start talking about the concepts of big data and data analytics, and then we will discuss their applications in healthcare. The promise is to simplify the concepts and discuss and explain the applications of these technologies in healthcare only in the way that can benefit us as healthcare and pharmaceutical professionals.
Data analytics and big data are two interrelated but different concepts. They have become integral to decision making and strategic planning in various industries, including healthcare and pharmaceutical industry.
As the name indicates, big data is data that is very big, very huge volume of data. So they cannot be stored nor processed by traditional computers. They need special, more sophisticated systems in order to store them and process them. So later on, we can analyze them. So huge volume of data. Imagine the data that is generated from healthcare on a daily basis. Imagine the data that is generated even from social media every day. They have calculated actually the number of data generated every minute on social media. And we are talking about millions and millions of terabytes and petabytes and even more. So huge volume. And this what describes and explains what big data is. Large volumes of data that cannot be processed or stored in traditional or conventional computers. They need more sophisticated computers and systems to store them and to analyze them or process them later on. So because this data comes from different sources, they are either structured or semi-structured or unstructured at all. There are criteria that describes each data set. And this description is very important so we understand which type of big data we are talking about, how big it is, how fast this data is being generated, and other criteria which are called the 5 V's. And we will see them now.
Big data refers to the extremely large data sets that may be analyzed using computers to reveal patterns, trends, and associations, especially relating to human behavior and interactions. It is not just about the data itself here, but also about the infrastructure and analytics used to handle and interpret this data. The characteristics of big data are often summarized by the following: volume, the sheer amount of data generated every second; velocity, the speed at which data is generated and moves around; variety, the different types of data, structured, unstructured, semi structured, and so on, from various sources; and veracity, the quality and accuracy of data. Finally, the value, which is the ability to turn our data into value And this is what really matters. Big data technologies include, but are not limited to, distributed computing, databases, and platforms that offer real time processing and analytics.
Now we come to data analytics. As I understand it, and in order to simplify things, it is the analytics that can analyze big data. So if we have a very big volume of data that is generated very fast, we need special systems in order to read this data and analyze it. We need special systems and special technologies in order to read the data and provide us with different types of insights. And data analytics is our way to do so. So, data analytics is the process or the analysis that is conducted in order to generate different types of insights from huge volumes of data. And they are classified into four main types. We will say something about each one of them, and then we will focus on the predictive analytics because the predictive analytics is very important for healthcare systems, for healthcare environments, for patients, for us. Why? Because if we as healthcare professionals understand some insights about the future, we will be ready and we will not be taken by surprise when it comes to an outbreak of a pandemic or an infection or some complication. So, predictive analytics is of special importance for healthcare professionals.
Data analytics refers to the process of examining, cleaning, transforming, and modeling data with the objective of discovering useful information, informing conclusions, and supporting decision making. It involves a spectrum of techniques and tools ranging from basic business intelligence and reporting to a more complex predictive and prescriptive analytics. Here are the breakdown of the key aspects of data analytics. The first is descriptive analytics. This involves summarizing past data to understand what has happened. It's often presented in the form of dashboards and reports. And then we have the diagnostic analytics. And this focuses on why something happened and typically involves more in depth data mining and drill downs. The third aspect is the predictive analytics, and this uses statistical models and forecasts techniques to understand the future and answer the question what would happen in the future. And last is the prescriptive analytics, and this suggests actions that we can take to affect the desired outcomes and answers the question what should we do.
Now that we are clear about the concept, what is big data and what are data analytics, I think it is time to understand the current and the potential use of these technologies in healthcare. And again, here, we don't need to go very deep because we will be users of these technologies and we will not create them or modify them. There are specialized people who are meant to do this, but we are receivers. We receive the technology and we get training on how to use them. So again, We don't need to go into a lot of details in order to be good users. The most important thing is to use them.
The interplay between data analytics and big data is very important. While big data provides the vast, diverse, and real time data landscape, data analytics provides the tools and techniques to make sense of this data. Together, they enable organizations to make more informed decisions, predict trends, understand the customer preferences, and dive deeper to drive innovation at the end of the day. In the context of medical affairs in the pharmaceutical industry, this could mean better understanding of patient outcomes, more personalized medicine approaches, and more efficient and effective research and development. The power of data analytics and big data is transforming how we understand and interact with vast amounts of information. The pillar of this transformation is the ability to generate profound insights that drive strategic decision making and inform our understanding of clinical trials, real world evidence, and market trends. Imagine a world where every detail from clinical trials, patient records, and research studies is part of a huge data set. Data analytic tools are the key to making sense out of all this data. They search through all this data, finding patterns and trends that would usually be hard to spot. For instance, consider the clinical trial data of a new medication. Traditionally, the analysis might focus on the primary outcomes, but with the advanced data analytics, we can dive deeper. We can examine subgroups of patients, understand side effects in different demographics, and even predict which patients are most likely to benefit from the treatment. This is more than data analysis, it's like insight generation, providing a richer, more detailed understanding of the medication's impact. Similarly, when we look at real world evidence, the data gathered from patients in everyday setting rather than controlled clinical trials, the potential is enormous. Here, data analytics can help us understand how a drug performs in the real world, which can be quite different from its performance in clinical trial setting. We can track long-term outcomes, monitor safety in broader populations, and gather insights that guide both the clinical practice and future research. Market research as well is transformed by data analytics. In a field where understanding the needs and behaviors of healthcare providers and patients is very important, big data tools help us to analyze everything from prescription patterns to patient feedback to even reactions on social media. And this provides comprehensive view of the market, highlighting opportunities, challenges, and the potential impact of new medications. However, the true power of data analytics and big data lies not just in the insights themselves, but in how we use them. These insights can inform strategy at every level, from research, development, to marketing and patient education. They can guide decision making, ensuring that it is based on solid foundation of evidence and deep understanding. That is to say, the role of data analytics and big data becomes increasingly central. By utilizing these tools to generate insights and actionable insights from clinical trial data, real world evidence, and other interactions, including market research, we can make informed decisions that improve patient care and enhance the drug development and ultimately transform the field for the better. Predictive analytics is a method used to forecast future events or trends based on current and historical data. It involves analyzing patterns in the data to predict what might happen in the future or what might happen next. This technique is becoming increasingly important in healthcare as part of the broader approach using big data to improve patient care and outcomes. In simpler terms, think of predictive analytics as the way of making an educated guess about the future. It's like looking at the clouds and wind to predict the weather for the next day. In healthcare, instead of clouds and wind, we look at the medical records, research findings, and other health data. Now, let's discuss how predictive analytics is used as part of the big data approach in healthcare. Big data refers to the vast amounts of information collected from various sources, including electronic health records, medical imaging, genomic sequencing, and more. It is not just the quantity of the data that is important here, but also what we can do with this data. So, predictive analytics taps into the wealth of the information to uncover hidden patterns, unknown correlations, and other insights. For example, by analyzing past patient data, healthcare providers can identify who might be at risk of a particular disease, and so they can take the preventive steps. They can also predict which treatments will be most effective for specific patients, leading to personalized care plans or precision medicine. In addition, predictive analytics can help healthcare organizations to improve their operations. For instance, they can forecast patient admission rates to better manage staffing and resources. They can also predict which patients are more likely to miss appointments and find ways to improve attendance to that extent. However, it is important to note that while predictive analytics can provide valuable insights, it is not foolproof. The predictions are as good as the data and the methods used to analyze it. Therefore, continuous evaluation and improvement of these analytical models are very important. In conclusion, predictive analytics is a very powerful tool in the big data approach, offering potential to transform healthcare by predicting future trends and events. By understanding and acting on these predictions, healthcare providers can improve patient care, enhance operational efficiency, and ultimately save lives. As we continue to collect more data and refine our analytical techniques, the potential for predictive analytics in healthcare will only grow. So, this is the future. Are we ready for it?